Hello and welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class healthcare provided at each of our Regional Health Command Atlantic medical facilities, dental clinics, and public health units to soldiers, their families, retirees, and other beneficiaries. November is Warrior Care Month. We celebrate the spirit of soldiers who face significant wounds, injuries, or illnesses, and their battle to recover, and those charged with providing them support and care. Some of these soldiers are unable to continue active military service. They transition back to civilian life. The Department of Defense teams with the Department of Veterans Affairs and the Veterans Benefit Administration to train wounded warriors and other transitioning service members in how to process VA disability claims. The 14-week program Warrior Training Advancement Course, or WAR-TAC, ends with transitioning soldiers armed with the skills of a Veterans Service representative, ready to work in Veterans Service Centers across the nation, helping future veterans.
When a transitioning soldier completes the WAR-TAC program, they have all the skills they need to process VA claims. That includes how to make eligibility determinations based on service, medical evidence, and more. Ordinarily, new Veterans Services representatives are hired, then are sent for training. WAR-TAC reverses that process. Transitioning soldiers arrive at their positions trained and ready to work.
This was a great opportunity to hire some outstanding folks who are transitioning out of the military, have them come to VA and start their careers fully trained. And it also eases one of the big concerns of folks who are transitioning out of the military is, what job am I going to do? This gives them that opportunity. So it's a great opportunity that I think is great for DOD. It's great for VA, but most importantly, it's great for the service member who's going to be becoming a veteran soon.
The WAR-TAC trained Veterans Service representatives bring the shared experience of separating from the military with the clients they serve. That shared perspective of service can put the clients at ease while motivating the representative.
It's a good thing to have these type of employees coming in to serve our veterans, because these cases here at the AMC, sometimes they're 8 to almost 40 years old. So you're talking about a veteran who's been waiting 40 years for disability benefits that he's entitled to. When you have an employee that pushes like that, you get more of these cases done, and these veterans deserve it.
WAR-TAC graduate Crystal Makowski reviews claims in Washington, D.C. The Army veteran cherishes the opportunity to help fellow veterans of different eras while getting to know some of the stories of their service.
Appeals Management Center, this is Crystal. A lot of them like to talk, and I don't mind talking as long as I have the time. I'll hear them, their stories, their backgrounds, and it just makes it that much more validating of what you do for them. Like, it makes it real, that you could hear it and you could see it and you could experience it with them. If you have nothing after the military, and you're helping veterans, you can't pass it up.
For the Regional Health Report, I'm Craig Coleman.
95% of transitioning soldiers who complete the WAR-TAC program get jobs in a VA Veterans Service Center. Many wounded, injured, or ill soldiers use adaptive sports to recover. At Fort Benning, Georgia, 100 soldiers and veterans attached to the Regional Health Command Atlantic Warrior Transition Units are competing in the Regional Warrior Game Trials. Those who excel go on to face competition from other medical command regions. The best get the chance to represent the Army in the 2017 Department of Defense Warrior Games this summer in Chicago. Team Army will face off against warrior athletes from the Navy, Air Force, Special Forces Command, and the United Kingdom in 8 sports. Next month, we'll bring you highlights from the competition. Finally, we salute the caregivers and leaders who dedicate themselves to helping transition soldiers recover. Regional Health Command Atlantic recently held its Warrior Care and Transition Program Cadre Awards for Excellence, recognizing 14 winners for warrior transition units throughout the region. 4 winners support soldiers assigned to the Warrior Transition Brigade National Capital Region and their families. They are Dr. Mary King, Best Primary Care Manager; Catherine Bentley, Best Physical Therapist; Staff Sergeant Eric Urias, Best Patient Administrator; and Staff Sergeant Roxanne Williams, Best Human Resource Specialist. Congratulations to our other winners assigned to Warrior Transition Units at Fort Benning, Georgia, Fort Bragg, North Carolina, Fort Campbell, Kentucky, and Fort Drum, New York. All will now compete for recognition at the Army Medical Department level. And that's the Regional Health Report for November. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. Thanks for joining us.